Hi, I'm Dr. Stan Steindl. Welcome to Compassion in a T-shirt. Dr. Michaela Swee is a board-certified clinical psychologist and a rising leader in trauma-informed, compassion-focused care. She serves as Director of Clinical Training in the Trauma Continuum of Care at McLean Hospital and is an instructor in psychology at Harvard Medical School. In this episode, Michaela shares insights from her groundbreaking research and clinical work on shame, self-criticism, and complex trauma. We explore how compassion-focused therapy can help people shift from harsh inner criticism to warmth and care, even after profound adversity. Michaela also discusses her recent studies on self-compassionate letter writing and CFT for ICD-11 Complex PTSD, offering both clinical wisdom and real-world hope. She's also the co-host of Compassion Collective, a podcast making the science and practice of compassion accessible to all. Join us for a conversation that's both heartfelt and thought-provoking as we dive into the healing power of compassion. And so I bring you Dr. Michaela Swee. All right. Well, Dr. Michaela Swee, welcome to Compassion in a T-shirt.
Thank you. I'm really glad to be here, Stan.
It's a little bit early here today, actually. Well, it's 7 o'clock, I suppose. That's not too early, but I had one of those nights last night. You know, when you have an early thing to get to, and then you sort of keep waking up, and the old mind is ticking over. And I just thought, oh, isn't that funny? It sort of prepares me to talk about our tricky brains.
Mm-hmm. I know those nights really well.
Yeah.
I know the tricky brain really well, and I know those nights really well.
It's a familiar thing, isn't it? The old tricky brain. But your CV is wildly impressive, to be honest. You know, it's sort of amazing some of the stuff that you've managed to do and produce and contribute. I wanted to sort of ask you, like, if your teenage self had been told, you know, that one day you'd be an accomplished therapist and supervisor and researcher and not least co-host of your own podcast, Compassion Collective, what would she have said, do you think?
Well, maybe there'd be like a go girl, like
yeah, right, yeah, okay.
Oh yeah, go girl, heck yeah. No, but I think there also probably would have been like oh no, what happened? You didn't make it to Broadway or Hollywood? That was my original dream and thinking when I was young, that I wanted to go into the performing arts and be an actress. So I think there probably would have been a little bit of a like, oh, that's a different career
Right.
path.
Yeah, yeah.
But teenage self would also be really, I think, in awe and excited about this career of helping people, working with people.
Yeah, it's sort of, it's fun to think back to that younger part of us, isn't it? And the hopes and dreams that were there, but also, you know, sort of sometimes the nervousness or the self-doubt, but that was around as well. But yeah, a few different responses, you know, sort of excitement and encouragement, maybe a sort of a kind of a curiosity about a change in direction in a way. That's interesting. Those original kind of aspirations, but then just in awe of what we might actually accomplish.
Yeah, it's funny. Actually. Oh, go ahead.
No, you go. Sorry.
Well, it's funny because I was imagining myself at different developmental ages, and as a teenager, I think I was probably my most critical self. And so I was imagining a little bit more of a critical, kind of sassy response for my teenage self, but I was also imagining myself at a much younger age. And sort of those kind of the quieter eyes, you know, to find out that I might be a psychologist one day and doing the work that I'm doing now. So I think my 9-year-old self and my teenage self would have had different responses to finding out about what I'm up to now.
Yes, yeah. Yes, that wide-eyed sort of, fascination of where things could go. That's a cool sort of an image. It's sort of fun sometimes, isn't it, to it's just occurred to me now that there's a sort of wisdom in our younger selves a bit. Often we think of our younger selves as the more vulnerable parts of ourselves, but it's actually interesting sometimes to reflect on the sort of the wisdom, or even that sort of even the sassiness, is a kind of a strength and a quality that is important.
Mm-hmm.
Yeah.
The creative mind too. I think I had a lot of creativity as a little kid, a lot of kind of adventurousness in me, a lot of imagination and creativity,
Yeah.
so those qualities too.
Yeah. What originally drew you to working with people who experience high shame and self-criticism? Because that does seem to be a real thread through a lot of your work. Was there a turning point there, or something that really drew you in, or sort of shaped the path that you've taken?
Yeah. So I'm thinking kind of how far back to go and sort of sharing my
Mm.
pathway and my trajectory. Well, I can start a little bit further back, and then you can tell me to skip forward at any point if you want to. But as I mentioned, when I was younger, I really wanted to go into the performing arts, and I wanted to. I did a lot of music, singing, and dance and acting, and I think starting at a very early age, I had a lot of interest in psychology and the human mind, human behavior, um, emotion, and it was really when I got to college, to my undergraduate years, that I started in a more formal way getting experience in psychology. And at that point, it was fun actually. I felt like I was able to kind of dive in and get experience with different subfields of psychology. I got some experience in developmental psychology and forensic psychology and social psychology, which I really loved. And all the while, I was kind of sort of running wild in the performing arts scene where I went to school. So I was doing I was part of like a few different singing groups and doing a ton of theater and film. My where I went to college, Wesleyan University has a really amazing undergraduate film program. So I was acting in student films. So I was kind of doing both side by side. And those 4 years of my life were really the time when I kind of saw how the arts and the study of psychology, the science of psychology, really complemented one another. And it started making a lot of sense to me. I think my own mind and my own interests and passions. And it was really toward the end of college that I realized, I want to work in more clinical environments. I want to work with people who are struggling, who need help, who need guidance. And so I took a little bit of time off after college before pursuing graduate school to move back to New York City, where I'm originally from, and to try my hand at acting professionally. So, I did the whole sort of working in the service industry and waiting tables to make ends meet while doing the whole auditioning thing. And it was a really formative year and a half for me. I think I learned a lot about myself, including that I did not want a career in the performing arts, that was a hobby and a passion, but not something that I wanted to try to make a living out of. And that's when I found my way back into clinical psychology, into research. And I think it really wasn't until then, skip forward a number of years toward the end of graduate school. So I went to Temple University in Philadelphia, Pennsylvania, in the US. And I did a lot of work throughout graduate school in the area of anxiety and anxiety related disorders, presentations. And my program was very cognitive behavioral in nature. And it was toward the end of my graduate program that I started. I had such a wonderful experience in my program, and I had an amazing mentor and advisor and clinical supervisors. Toward the end of grad school, I started getting kind of itchy for more. I wanted to expand my horizon in terms of theoretical orientation and just get exposure to more ways of working with people. And in the early kind of days of my clinical work, that's when I really started, I think, becoming very interested in working with shame and self-criticism and that area, and sort of seeing some of the ways in which certain approaches that were being taught weren't quite cutting it, I think, in terms of some of the folks that I was working with. and certain experiences of suffering that I was meeting in my clinical work. And so it was toward the end of graduate school that I came across compassion-focused therapy, and sort of happened upon it in a funny kind of coincidental sort of way, which I'm happy to say or to talk about. But that was really when I started sort of becoming interested in shame and self-criticism as these transdiagnostic constructs, experiences that many people struggle with, and struggle with in a way that causes a lot of pain and a lot of suffering, and thinking about ways to meet people in those common sort of experiences became really interesting to me. And it really felt like that was the turning point. Like my fifth year of my PhD program sort of set the stage for what now has become, whatever it's been now, the first 5 to 7 years of my early career. So that's kind of how I stumbled upon this area of interest.
Isn't it interesting how, the performing arts and acting, for example, really is a study of human behavior and the inner world of characters really informs then the performance of that character, and exploring even some of these themes, I suspect, of the self-conscious emotions and shame and so on, as we're trying to kind of, I'm not sure what the right acting word is, but sort of channel that kind of character on the stage or in film. And so you've always had that curiosity, I suppose, about, what it is to be human. And it sort of straddled both the performing arts and then the psychology as well. I'm kind of, I hadn't really realized that about you in terms of, a year and a half doing the waiting tables and trying to get a gig thing. I mean, that's a sort of, that's an amazing kind of, it takes a lot of courage to really put oneself out there and see, like what might happen if I really devote some real time and energy to this thing. But yeah, you kind of decided that you wanted to help people, you wanted to be helpful and move more into that clinical sort of a thing. What was the CFT? Oh, sorry, were you going to?
I was just going to say, yes, I think that was really beautifully put. And with sort of acting, one of the things that I loved about it, and I realized this was part of my realization, I don't want to do this, as my career, because, and I don't know that I could have, even if I wanted to, but part of the reason was because I really loved being part of a cast, part of a community, putting on, and I'm mostly talking about theater productions here, being part of a cast, putting on a production together, and the experience of being able to observe myself. And like you said, that experience of stepping into a character or stepping into a role, right? And really kind of fully stepping into it, making it your own, but also observing other people doing that too in their own process. I think was something that I just always really loved. And when I was a young adult and starting to try to do this professionally, I think there was so much time in my life that was being taken up by just the trying to survive and put food on the table and make ends meet, that I wasn't actually doing as much of that part of things that I loved. It was more of a hustle. Yes. And I think one other thing I'd say, Stan, too, going back to your question about why shame and self-criticism, and I don't think I really found sort of the way to think about this and put words to it until my adulthood. But I've realized as an adult, I think as a kid, I was very afraid of my own mind. I think as a kid, I struggled with a lot of what I wasn't really aware at the time was the experience of shame. And it's interesting, I actually listened recently to a conversation you had with Marcela Matos. And I was thinking about shame memories and thinking about the value of compassion, receiving compassion from others, self-compassion as sort of a protective buffer against experience of shame. And I was thinking a lot about, wow, I think as a little kid, I was lucky enough, fortunate enough to grow up in a really loving, nurturing, warm family, nuclear family. And for whatever reason, because of the way my tricky brain is made up, I had a lot of experience of fear and shame as a kid. And I think it was really not until this sort of later stage of graduate school, getting all of this professional and educational experience in psychology and seeing the experience of shame in so many of my clients who were struggling with all sorts of different human struggles, that started to help me put a language to this common experience and really wanting to focus on it.
Not to pry too much into your early life, but was there anything about the performing arts and acting that you sort of arrived there as a way to process or work through some of those even earlier feelings of the self-consciousness?
It's a really that is a really good question, an interesting question. I'm not sure that I've really thought about that before, and kind of food for future thought. But my gut reaction, my gut instinct is, yeah, probably. Like I think there's something about performing and being able to express and explore oneself and try different things on, and also in community, what I was just talking about, that experience
Yes.
being part of a cast and a community, and having sort of the safeness, the social safeness, I think to explore with other people. And I think many times artists are people who tend to be interested, I think, in psychology and emotion and their own minds and other people's minds, in the minds of these characters that they're playing. So it felt like, I think, a really rich and safe environment to probably explore my fears, shame, self-criticism, all of it, I think.
Mm. And you sort of mentioned that then the experience in New York was more of a hustle, I think, or something. And so, yes, that the some of those contextual, environmental, social environment of college and being a part of a sort of an acting group and those sorts of things, had those components. Later on, it was tougher. It became more kind of perhaps a competitive motivation. You were having to sort of compete to win roles. It started to feel a bit different.
Yeah, more of my threat system online, I think, during that period, as opposed to some of the other really sort of nurturing and wonderful theater experiences I had, where it was actually more, it activated my soothing system, and
Yes.
I was really being more creative and experiencing joy and feeling, in connection with other people. It was quite a different experience, but both in the arts, but very different
And
experience.
and what was the story of you stumbling across CFT?
Yeah. So initially, as I mentioned, in graduate school, I was mostly doing work on anxiety disorders and social anxiety in particular. And I was really fortunate to have a mentor. My advisor during my PhD program was nearing the end of his career. And I think at that point, he encouraged a lot of us to really think about what it was that sort of made us most interested. And it was right at that time that I saw this listing. I don't even remember where I saw it, but it was this flyer that's, listed Dennis Turch's name, and I didn't know his name at the time. Dennis Turch is giving this, few-hour workshop on compassion-focused therapy in Philly. And I was like, that's really interesting. I've never heard of CFT. I've never heard of Dennis Turch, but I pinged one of my best friends and the co-founder of Compassion Collective,
Ah, yes.
one of my peers in grad school, Susan Murray. And I said, look at this. I can't go. I'm traveling, but you should try to go to this, because we had some similar interests. She went, she came back to me and she said, oh my God, Michaela, this is gold. And it was right at that time that Dennis and Laura and some others were scheduling the inaugural Compassionate Mind retreat and summit in Sparkle, New York in
Yes.
2018. And so Susan, my best friend and colleague, and I, got some support from our program, and we got on a bus and headed up to Sparkle, New York in 2018, and had what really were quite a transformational several days at that retreat and summit. I think transformational personally and experientially. We were guided through exercises. I'll never forget an exercise that Deirdre Fay led us through, a very, very embodied physical exercise that left me sobbing afterward. It was so powerful and profound for me, that experience. And Kelly Wilson walked us through an exercise where Susan and I were sitting across from each other, almost with our knees touching, looking into each other's eyes, not being allowed to speak or using verbal signals, but just watching and looking. And the two of us, again, I don't think Susan would mind me saying, we probably talked about this on an episode of our podcast too, but we both, just were in tears. And she and I share a very, close relationship, a very intimate friendship. And still, what we experienced in that exercise in that room was something that we hadn't experienced together or apart probably ever before. And after that retreat, we took I'll never forget, we rode that bus back to New York City in silence, just sitting next to each other, our hearts tremendously full, our notebooks,
Also
full,
full.
also full, overflowing. And we got back to our program and we said, let's get some supervision and let's start a CFT group in our training clinic. And so we started, I think we started with 8 people, a transdiagnostic 8 clients, a transdiagnostic 12-session CFT group with consultation with Paul Gilbert and some other folks. And we ran this group. It was an incredible, it was an incredible training experience, but it was an incredible personal experience. And we gathered some data in that group and sort of got feedback from participants about what some of the most useful parts of the group were. Self-compassionate letter writing was one of the tools, and experiences that we worked together in group on that a lot of our folks found immensely helpful. And then that set the stage for my dissertation. And I'm happy to talk about that too, but then that set the stage for moving to Boston and coming to McLean Hospital and Harvard Medical School, where I've brought CFT with me and now working in more of a trauma-focused population of folks. But it was really that kind of flyer about Dennis Turch's CFT workshop in Philly that in 2018, that set the stage for what would be the next 7 years of my career and counting.
Yes, Dennis and Laura too. They're so inspiring, aren't they? And the couple of names you mentioned there, that also I find very inspiring. And I didn't go to the 2018 one, but I think I went to the 2019 event in Sparkle, and very, very moving and the experiential side, isn't it? I suppose that really is so powerful in CFT. CFT draws on all sorts of body-based and imagery-based, but also in a way just the sort of acting and embodiment practices, which can feel so moving. And I too have experienced the sobbing thing that happens when one really gets into contact with compassion, because you're sort of also getting into contact with suffering, I suppose. And it's a very powerful, moving experience. The amazing thing that you did was also just turned that into productivity pretty quickly, to be able to run a program and to get feedback and to sort of provide some data and all of that sort of thing. And you did mention the letter writing, and I suppose I wanted to check in with you on that paper, your letter writing study, and because it's a beautiful example of I was going to say simple, but it's not necessarily easy, but there's sort of the practice of writing a compassionate letter to oneself and the way that just how powerful that can be, but the kind of pretty sciencey way that you looked at that. You did a bit of a randomized control study with that. Tell us a bit about that study, I suppose. Give us a sense of what you did there.
Yeah, absolutely. I was really excited for that study because, again, I prior to the Sparkle New York, CFT summit and retreat, I really didn't know yet what I was going to do for my dissertation study. I was still also, again, kind of looking. I was more in the cognitive behavioral realm of things, and I was more in the sort of social anxiety and anxiety disorders realm of things. And it was really, again, that group that Susan and I led together following that CFT training experience, and seeing how powerful the group was as a whole for the clients who participated in it. But specifically that intervention, the letter writing, was so moving to see and to experience as a group together that I kind of knew instantaneously, I want to focus on something around compassionate letter writing. And so one of the things that's hard as a doctoral student, we have a saying like a good dissertation is a done dissertation, so trying to figure out feasibility,
Yes.
like what is a study that's interesting to me and engaging, but one that I can also, finish and get my degree. And it was really fun to be able to find something that I, felt really passionate about and start to think creatively about how to work with some of the people who I was interested in working with. So those were folks who were more shame prone, people who were suffering, right? And work in this more university environment. That was, my subject pool, university undergraduate students. So what I did was I started to think about, okay, could I work with students in this population who are experiencing high levels of shame? And that's what I did. I recruited students who were interested, for course credit and participating in the study, who scored in the upper quartile of a self-report measure on global shame. And I randomized them into a control group and the intervention group. And so the study was essentially a 2-week self-compassionate letter writing intervention for individuals experiencing high levels of shame. And one of the really fun parts of this project for me was sort of looking at the existing literature, seeing what other self-compassionate letter writing studies had been done, and thinking about how I could add to it. And I think I talk about this in the published paper, but one of the things that I was really interested in doing was trying to think about how to use the senses, so our hearing and voice tone, to help stimulate this compassionate social mentality and help people as they were engaging in the letter writing. And so not only did I provide, I essentially used a platform, an online platform that had written instructions, but also had audio recordings of my voice leading people through the exercise and helping set them up for different prompts and different sort of warm-ups to lead to the actual letter writing. And that was a really, I think, fun, interesting part of the project, because it allowed me to be creative and actually feel like I was interacting with the people who were, interacting back with the intervention. And it's also something that I can talk more about this at some point in our conversation too, but I've taken that idea of recordings into the group work. I mostly do CFT group work now with, people who've experienced complex trauma. So understanding that actually those voice recordings are something that that's really, really helpful for people, having a voice to listen to, cueing that, not just the language, but the vocal tone.
The tone, yeah.
Right, which is hugely important in CFT, I think.
Yes, it seems to be one of the kind of the foundational elements, isn't it? Is to be able to sort of shift the tone of that self to self relating, perhaps the inner tone of voice, but also participants were asked to read the letter out loud to themselves as well. So you had that tonal, if that's the right word, component to it too, where they were practicing. They were doing the writing, but also practicing the voice tone. And no doubt your voice acting kind of, came to usefulness in all of that too, to be able to kind of, perform and to model the kind of tone that we're trying to use.
Yeah, absolutely. And I think there was certainly a modeling and scaffolding part of this, hearing my voice and sort of me in a very authentic way, actually, because as I was recording these clips, I often had my eyes closed. I was really kind of tuned into my own body, right? I was working on my own sort of compassionate embodiment as I was using my voice to help walk people through the exercise. So I think, hearing that, and then, like you said, the aspect of the intervention that included, people reading their letters out loud to themselves, I think was a very important kind of transferring of maybe some of that tone and embodiment. And what we found is, like, in this very brief study, a brief, like you said, simple, I think is a good word, not easy, but simple, 16-day intervention, we found that folks, levels of shame were substantially decreased, self-criticism was largely decreased, so was anxiety. And then we saw, increases or marginally significant, but large effect size increases in self-compassion and decreases in depression as well, depressive symptoms. And those gains were maintained 2 months after the study as well. We did a little follow-up period. So that's cool too, that like a 2-week, 10 minutes a day, writing practice that 2 months later there were sustained benefits of that.
Mm. I will have a link to these papers in the description, so if people want to have a look. But I really appreciated table 2 in your paper, and a couple of things stood out. One step there was participants were asked to identify up to 10 pros and 10 cons to developing self-compassion, and I wondered, is there a little flavour of motivational interviewing that's sneaking in there?
I think, yeah, I think absolutely a flavor of motivational interviewing. I think also a flavor of, we do that in cognitive behavioral therapy too, right? We talk about pros and cons for engaging in what may be really hard work and what will involve, a pretty substantial commitment and investment. When I was in graduate school, I was working in a lab and clinic that specialized in helping people with social anxiety disorder using CBT. And that was always one of the first exercises we did at the very beginning of therapy. Was we looked at pros and cons for doing this therapeutic work now. And so, yes, I think that part of my intervention definitely borrows on MI and borrows on CBT and some other interventions too that help sort of people look very honestly at their buy-in and the reasons they might want to try something, the reasons they might not want to try something. And I think I didn't realize this at the time because I was much earlier in my CFT training. But now I realize, 7 years later, whatever it's been, that I was also starting to help people work with fears, blocks, and resistances too, right? Yeah. Which is such a huge piece of the CFT work. So
yes, absolutely.
That would be an interesting study to see, what was it like doing the pros and cons exercise for people? I don't know.
Yeah, no, that's certainly what jumped to mind for me. Was it's exploring the facilitators and inhibitors of compassion or self-compassion, and kind of, I guess, exploring the ambivalence that people may, well, probably will feel. People do have, certain inhibitors there, the fears, blocks, and resistances, as you say, and especially to self-compassion. And so to be able to kind of validate that side of the ambivalence, but also to sort of tap into the wisdom, what might be some of the pros or the positives of actually more self-compassion as well, and just kind of laying that out there at the very beginning to, I suppose, it just, helping people to reflect on some of that for themselves.
Yeah.
How did you define compassion or self-compassion for the participants?
So for participants, and I still operate from this kind of definition and understanding in the groups that I lead here now, I talked about compassion as being sort of about how we meet ourselves and each other in moments of suffering. So I kind of introduced the 3 flows of compassion to participants and talked about how self-compassion is really about, sort of how we become aware of moments when we're struggling and having a really challenging time, and then having, the intention and motivation to try to be helpful, to try to help ourselves in those moments. So that's how I defined it for participants.
And I noticed that the day 1 of the intervention really was about compassionate letter writing towards another person as well. So you sort of, I guess, practiced that flow first, and then by day 2 started to move towards self-compassionate letter writing, and then it was, I guess, 16 days of that from there.
Yeah, or I guess 14 days of that from there, of the self-compassionate letter writing. But what's interesting is I think a lot of folks who are shame prone struggle with immediately directing compassion to themselves. And I see this a lot with, people who have experienced complex trauma, and severe trauma who I work with now. But even then, my thinking was a little bit around, it might be really hard to just kind of start asking people, with writing a self-compassionate letter, that might be a difficult place to start. And to start practicing using this definition of compassion and some of the language and intention directed towards someone else that they cared about, or even, someone they saw struggling on the street, maybe a stranger, but to first start with exploring the flow of compassion out toward another before turning the lens inward.
Yeah. And did you track treatment engagement or treatment adherence, or how how many the percentage of days people actually managed to do the letter writing or that sort of thing?
That's a really good question. And you're making me go back, 6 years in my mind to thinking about
Sorry.
my no, this is good. It's keeping me on my toes. If I'm remembering correctly, I think what we did is we controlled for the number of letters that people wrote, and we used that as a measure of engagement. So how many days of the intervention did people participate in? How many letters did people write? We controlled for that in our analyses,
Yes.
and found the effects that we did.
Yeah. Yeah. No, it's very encouraging study. I mean, the sort of the effect on shame and self-criticism and anxiety, I suppose. That's it for a 2 week relatively light touch intervention, writing little letters to ourselves for 20 or 30 minutes a day has a pretty sort of important effect on people's sense of self and self-relating and those self-conscious emotions and amongst an early university student sort of a sample. I mean that's one of the things that can really be dogging them, can't it? Is those feelings of am I good enough? Am I an imposter? Can I do I deserve to be here? All of those sort of dilemmas that young people can feel. You alluded to now working also more specifically, I guess, in complex PTSD. Just give us a little sort of primer on CPTSD.
Sure. Yeah, absolutely. And I guess can I say a little bit about my role now where I work?
Yeah,
Sort of
great.
the last part of the trajectory, my career trajectory. So at least in the US and clinical psychology doctoral programs, the end of our training, we get matched for a year to finish our final year of training at a site somewhere around the US. And that's what brought me to the Boston area in Massachusetts. I matched for my internship year here at McLean Hospital, which is an affiliate of Harvard Medical School. And that's where I've stayed. So since 2020, I finished out my pre-doctoral internship. I got my doctorate, stayed for my postdoctoral fellowship, and then the past 3 years, I've been working as a staff psychologist in the trauma continuum at McLean Hospital. And so, it's interesting to think about. I was wrapping up my dissertation when I moved here and was kind of finishing my training. And then I was thinking about sort of how to bring CFT to the populations that I'm working with most now. And that's where I really started getting very, very interested in applications of CFT for people with serious polytrauma histories. And so it was about 3 years ago that I started an outpatient compassion-focused therapy group here in the trauma continuum. So here I do clinical work in my role. I also am doing ongoing research on compassion-focused therapy, specifically for trauma. And I'm the director of training and education for our group. And so I'm also involved in sort of training a large interdisciplinary group of trainees, psychiatry residents, psychology students, nurse practitioner students, and social work interns as well. So I'm doing a lot of CFT training with junior colleagues and trainees here. And since starting, some of whom are co-leading the CFT groups with me, the outpatient groups. And since I started that group in our program 3 years ago, I think we've run it's a 3-month outpatient group. And I think we've run about 25 of them with over 140 patients or so. And it's been an incredible experience and sort of like the latest chapter of my CFT work journey, which has been, just really amazing. But I realized I lost track of your initial question, which made me think of what I'm doing now.
That's all good. The original question was just to give us a bit of a sense of what complex PTSD is, perhaps, and also, I suppose I was going to then go on to ask about, what might be some of the unique needs of people that perhaps compassion can help. I suppose is where I was heading.
Thank you so much. That brought me right. Complex PTSD. That's where I am now.
Yeah.
So
Yep.
I think in terms of complex PTSD, it's it's a new diagnosis, and it's a controversial diagnosis. The DSM-5, at least in the United States, I think less controversial maybe in other parts of the world, I've been learning, which is interesting. Like, for example, in the UK, I've spoken to colleagues who seem to be sort of using that diagnosis more liberally, more freely. But here we still use the DSM-5, and complex PTSD is not a diagnosis in the DSM-5. But it has in the last few years become established in the ICD-11. And so what we know about complex PTSD is that in order to meet diagnostic criteria for complex PTSD, someone needs to meet the classic criteria for PTSD. So again, those classic intrusion symptoms and avoidance symptoms and hyperarousal symptoms. But in addition to that, they also experience what in the ICD-11 are known as DSO symptoms, disturbances in self-organization. And so those are things like negative self-concept, so that, really core sense of pervasive shame, self-blame, seeing oneself as tremendously unworthy or undeserving, unlovable. Also patterns in emotion dysregulation, so having trouble self-soothing, having trouble managing complex, painful emotions, and then struggles in relationships is the third kind of subcategory of those DSO symptoms. And so when I think about compassion-focused therapy, I think that CFT is hugely applicable and can be hugely helpful for people who are experiencing complex PTSD, which tend to be people, this is not a requirement in order to meet criteria for the diagnosis, but CPTSD tends to affect people who've experienced pervasive, ongoing, early traumatic experience, and oftentimes at the hands of important people in their lives, caregivers, people who should have been taking care of them. And so when I think about the applications of CFT in this population, we're kind of addressing all of those targets, right? We're addressing, when we think about classic PTSD symptoms, we're helping people manage intrusion symptoms. That is suffering. When you have a nightmare or a flashback or experience an intrusive memory, how do you learn to meet yourself in that moment, right? A lot of people who come and seek treatment initially are experiencing high levels of kind of fight, flight, freeze response, high levels of dissociation, sometimes trying to do their best to help themselves, but not knowing how to help themselves. So sometimes contributing to more prolonged experience of suffering, right? So when I think about PTSD, I'm thinking about sort of ways that we can help regulate people's nervous systems, how we can help rewire, in fact, brain circuitry and nervous system responses. So those intrusion symptoms, the hypervigilance, right, and hyperarousal symptoms, all that really sort of autonomic nervous system activation, and also helping people with avoidance, right? Like, I think that CFT is an exposure-based approach, right? Because what we're saying is we're not going to turn away from experiences of suffering. We're actually going to find ways over time to learn how to turn toward those experiences, to learn how to be helpful rather than harmful to ourselves, right? So I think those are some critical ways that CFT can be helpful for PTSD. And then when we think about this sort of layer of complex PTSD, right, where people are struggling with negative self-concept and emotion dysregulation and relationship struggles, right? Like, CFT targets those things directly. How do we work with the shame, right? How do we help ourselves regulate emotions when we get dysregulated or when we're panicked or, in high levels of distress? And also, how do we help ourselves be in greater connection with other people and ourselves, which is something that a lot of people have never learned to do before. And a lot of people have come from life contexts and situations where it was never available for them to do that. It was never taught or modeled or safe to do that. So I think for all of these reasons, CFT is an enormously helpful approach for many of the people that I work with.
Yes, it's the sort of the relational or attachment trauma and tragedy of people's lives, isn't it? That really is so devastating, and I suppose has a real impact on soothing affiliative system. That the idea of being able to feel close and connected or calm and safe in social sorts of or relational situations, all of that has been kind of compromised in a way. And so it becomes very difficult to activate soothing system in order to sort of regulate threat and drive and so on. And so therefore there's this threat system activation all around social relational threat. And that's the bread and butter in a way of CFT, you could say, is how to sort of build and develop soothing affiliative system and then find our way to compassion and self-compassion to approach the suffering. But you've got this most recent paper, which is compassion-focused therapy for the treatment of ICD-11 defined complex post-traumatic stress disorder. And again, box one, I really appreciate it. I love the way you have summed up a couple of things in really helpful tables and boxes. So thank you for that. But yeah, just the importance of courage, I suppose, is something that stood out there, and you know, how to sort of cultivate that strength and courage to turn towards suffering. I think Paul Gilbert would wholeheartedly agree with you about that notion of exposure and some of the core principles of classical conditioning and the way that we might use exposure to kind of desensitize some of those sorts of things, of being able to find the strength and courage to approach suffering.
Yes, absolutely. And you know, I think those two words, courage and wisdom, they're words that we come back to again and again and again throughout our 12-week, group with folks. And interestingly, I'm doing some research now, both quantitative research on sort of examining how the group has been helpful to people, but also qualitative research, an interview-based study on sort of how folks have found the group, what's been helpful, and I hear again and again and again people coming back to how tremendously meaningful and kind of transformational this new conception of compassion and self-compassion that they're gaining is, and those two words, courage and wisdom. Because I think, one of the challenges when you're doing CFT work with people who've experienced very severe, harmful, traumatic experiences, especially with caregivers, right? Especially, harm that occurred in the context of important relationships. When you start talking about like being nice or being kind at the beginning of compassion, I think oftentimes you hit a wall very quickly with people, because so many of those fears, blocks, and resistances and the core beliefs around like, I don't deserve to be nice to myself, I don't deserve to have anyone be nice to me, right, come up. And so I've gotten the feedback from so many folks that this idea of courage and wisdom, suspending the idea of niceness or kindness, and I would argue that there's an important distinction between being nice and being kind, right? But before even using those words, can we just talk about the strength and bravery and courage it takes to lean in, to lean toward pain and distress that we're experiencing, as opposed to avoiding and running away from it, right? And can we begin to cultivate and tap into that wisdom and build greater wisdom around how to be helpful to ourselves and to each other rather than harmful? And I think that orientation is such a shift for so many people, right? And such a different understanding of compassion than is so frequently offered, by pop psychology and that we see in the media.
Mm. Yes, it definitely distinguishing it from niceness seems really key and important, but even distinguishing it from kindness, it often, self-compassion is a bit about self-kindness, but kindness isn't always to do with compassion, I suppose. So it's sort of interesting to disentangle those.
Absolutely. And I think, with people I work with, a lot of times we're talking about boundaries. We're talking about self-advocacy and how to say no for people who have never been taught how to say no, right? And to keep themselves safe. And sometimes that is not, the kind, nice thing, right? But that does require courage and it requires wisdom. So I think you're right that separating those things can be really important.
Mm. One of the other things in box one is to do with yeah, just sort of exploring the inner self-critic and what the critic says to them, but also what are the fears, perhaps, or the origins of that critical part, and trying to sort of, I guess, get to the bottom of perhaps the motivations behind the self-critic. And you talk about CFT helping people shift from a blaming, self-critical sort of style to a sort of a wise and compassionate one. What sort of practically do you do to help people make that kind of a shift, or to help the people in these groups make that shift?
Yeah, that's a really nice question. And I think the answer to that, it takes a lot of time. Right. And one thing that I often talk with folks who do my group about is how this group is really just setting the foundation for future practice and future commitment, to the ongoing commitment to this work. But I think in our group, some of the things that really help people, we talk at the start of the group about how one of the really powerful reasons and powerful ways that CFT can really help people in group format is that we're working both with interpersonal relationships and the intrapersonal relationship, right? Which is about that sort of self-relating. How do I sort of notice myself, my inner self-critic? How do I respond to my inner self-critic? How do I begin to reshape and shift that relationship? And so a big part of the work early on in our group is just about starting to build that awareness. What is an inner self-critic? Oh my gosh, that's an inner self-critic. That voice is talking to me 24/7 all day. Okay, what are the things that voice, that inner self-critic, what does it say? How does it sound? What is it, and we do a functional analysis of the self-critic in group, which is a common, CFT practice. So really looking at, what does the self-critic look like if we had to put some imagery, right? And I think that's often a very interesting exercise for people in beginning to diffuse and start to create a little bit of distance and personify the self-critic, right? As opposed to being so fused with the self-critic and not being able to look at, it's just sort of like looking from the self-critic, right? So that ability to look at my inner self-critic, what might she look like if I let myself put some imagery to her? What does she say to me when I'm struggling, right? What do I commonly hear in my mind when I'm struggling? What does that inner self-critic want to do to me? Right. And I think especially recently, Paul has spoken more about sort of differentiating that sort of that part of the self-critic that is really about that perceived inadequacy and the failure, and then the aspect of self-criticism that is really hostile. And so we talk about that in group too. Like, are there, ways in which certain aspects of your inner self-criticism kind of take that flavor of, worries about failure and not being enough and being inadequate? And then are there also ways where that inner self-critical voice can become quite hostile, quite violent, quite harmful. So we sort of do that piece. And then we also talk about, beginning to dig into, okay, so if we start to sort of get a better sense of this inner self-criticism, what it sounds like, what it looks like, first, how did your inner self-critic come to be? Right. I think that's a really important part of the work and sort of the population that I work with, especially, right, in thinking about origins of shame and self-criticism. It didn't start with you, right? How was this voice internalized? Like, now, yes, you're an adult and it is yours, right? This is it exists inside your mind, right? But oftentimes people talk about how their inner self-critic resembles a parent, or resembles, someone who harmed them in the past, or resembles, some other person. And that image has sort of become sort of an internalized presence, right? But so I think it starts with that awareness. We start by putting language and imagery and sort of real statements to the self-critic. There's something that's really powerful in the room for folks, I think, hearing from each other about what those experiences are like. For a lot of people, it's the first time they've ever kind of thought out loud or said any of these things out loud. And so to hear back, oh my gosh, my self-critic says the same thing to me, or, those points of relating and connecting, I think, are tremendously powerful for people. And then over time in the group, once we really start to develop a core awareness of that, then it's about, training that compassionate mind, right? So moving away from that threat-based, competitive social mentality, right, to this more compassionate, caring social mentality, and beginning to cultivate that mind, and then bringing that mind, I think, to the self-critic is what we do over the course of the 12 weeks, more toward the end. And I think, again, that experience of toward the end of the group, we do an exercise where we essentially sort of practice taking some space and just observing and seeing if we can just look at the inner self-critic. And for a lot of people, this was actually something I did in that 2018 retreat. But that sort of image of imagining yourself holding your self-critic teeny tiny in the palm of your hands, that imagery, I think, can be immensely powerful for people. This idea of taking away power and ferociousness from the self-critic and imagining your ability to hold this inner self-critic and to have the power and the agency, and to not necessarily be needing to change anything or alter anything or fight back, but just to look and watch curiously, and then to bring some of that compassionate understanding to those fears and to the way that self-criticism shows up in our day-to-day lives, the ways that our inner self-critic interacts with us, and starting to say, okay, like, hang on, this may be sort of the habitual way I've learned years and years ago to relate to myself, to interact with myself. What would it look like to try something different here with the fears, that I hold in mind, and understanding that those fears make a lot of sense for me to have, for this, personified inner self-critic to have, given my experiences and, the life that I've lived.
Yeah, you have a real way with words. The way you describe that really sort of brings it alive. It's kind of, we move from looking from the inner critic to looking at the inner critic, and then we move to looking at the inner critic from the compassionate mind sort of thing. And, that's kind of the shift. Like you say, it takes time, it takes practice. It's the beginning of that journey, really, although there can be some really impactful moments in amongst that, certain imagery that really can kind of be very helpful, or certain, like you do, certain ways of describing or putting it into words. Do you bring the acting in to your groups? Do you do sort of, chair work or embodiment work, or even some of the method acting that sometimes we use in CFT?
It's such an interesting question. Maybe this is something for me to think about a little bit more for myself, because I sort of, I don't know why, but I bristle at the idea that I'm bringing acting into the space.
Yeah.
Because I don't think I am. I'm not, I'm mindful that when I'm working with people, in a therapeutic relationship, whether it's in a group or individually, I feel very far away from acting. And there's something about myself as an actor, or certainly as an actor in the past. I guess once an actor, always an actor. But I think there's something about that part of me, that part of myself, that does bring creativity and imagination and play, right? And flexibility into the work, right? And so I think that that is what I bring from that part of me, that actor part of myself.
Yeah.
Is this sort of freedom to try things on and to be messy and to, make mistakes and experiment. It's really interesting, actually. My advisor in graduate school, he would listen. We recorded all of our sessions. He would listen to them and then give us, really wonderful, detailed feedback. And one of the things he said to me really early on, this is like 10 years ago, he said, you do such amazing behavioral exposures with people. Like how do you do that work? And it's funny, when he said that, it made me think, well, it's because I see it as improvisation, right? I see it as play. I do see it as let's try some different things on for size. Let's step into a different character. Let's see what that might be like. Let's allow you to separate from aspects of yourself right now that maybe don't serve you, or let's let you explore something that you've never done before, something you've never said before, an emotion that you don't allow yourself to feel, or that feels inaccessible. So I think in that way, I guess I would, rather than the word acting, I think I keep going to creativity in my mind. I bring the creativity into some of those role play exercises or behavioral exposure exercises.
Yes, I mean, I suppose I was curious. You mentioned the word character as well, and I suppose I was curious about whether, in that creative, playful way, the clients or the participants themselves might enact their compassionate self and use acting in that sense to not to sort of fake it, I don't suppose, but with this genuine intention to act and practice what it's like to sit or stand or move or look out through the eyes of that compassionate self, and bringing a kind of an acting practice to that, and maybe shifting to what it would look and stand and move and feel like, in a when in that critical part, and then shifting the body into the compassionate self. So yeah, I was kind of curious about whether there is some of that kind of kind of stepping into character almost to as part of the practice.
Absolutely. I think that's beautifully, I think that the way you just said that is beautifully put. And you also just made me think too, that one of my favorite things about doing CFT work in group, right, is that we're a community doing it together.
Yes. Goes right
Right.
back to the start.
Yeah, it goes right back to the start that we're, we're part of this cast. We're
Yeah.
part of a really important kind of community doing this work together, that we're not alone in it. And I think that can take some of the vulnerability and fear and self-consciousness, well, not necessarily out of it, because I think all of that is a natural part of it, but we can be in it together.
Mm. You're working with people in great pain, really. The sort of presentations and the experience of what it is to sort of the experience of CPTSD, and you're working with them with early career psychologists and other professionals, by the sounds of it, who are kind of learning their thing as well, and you're sort of supervising and so on. What has all that taught you about just what it is to be human, what it is for the people, the participants you're working with, what it is for you too, to be, the courage, I guess, that it takes for therapists too, to sort of move towards suffering, but also, managing that for themselves. What are your thoughts around all of those little dynamics?
Mm. Well, one of the things that I was thinking about earlier when we were talking about the retreat, the summit, and those experiences that each you and I have had of doing some of the experiential CFT work, on our own, and having those moments where we find ourselves sobbing, or we find the painful stuff stirred up in us. I think one of the things that was so profound for me in that early 2018 retreat and summit, and that has been so important for me in the CFT work that I've done, ever since, over the last 7 years, has been this leveling. I think there was something for me, in my graduate training, that I grappled with quite a bit around that imposter syndrome, feeling like a fraud, feeling like an imposter, sort of my own sense of shame, I think, early on in my graduate training. And I see that a lot in, early career professionals and trainees who I work with. And so one thing that I like, and doing this work with patients, and again, the folks that we treat in our program who have complex PTSD, who have dissociative disorders and other complex, trauma related presentations, is this human leveling that happens in this CFT work. Is that there is something that we can all relate around. There are common aspects of our experience, right? And I think, going back to a question that you asked me about sort of why shame, why self-criticism, as being something I really kind of hooked into as my passion, is that shame did not start in a vacuum. and it doesn't finish in a vacuum, right? Shame is not caused in a vacuum, and it doesn't heal in a vacuum. That shame heals in the context of social relationships, social safeness, corrective healing experiences. And I think that is one of the most impactful parts of my work, both, as someone heavily involved in training and education, but also someone who does a lot of this, CFT and clinical work in groups, is seeing common experiences of pain, right, and of tragedy, of trauma, and also seeing ways that people with their strength, with their courage, their bravery, their perseverance can come together with the common intention of being willing to look at it together and being willing to work on recovering and healing together. I think that that has been sort of one of the most I think powerful experiences of working with people who have experienced a great deal of hurt and harm in their lives, and working with trainees who are here hoping to do this work too in their careers.
Yeah, shame, sadly, I suppose, really is sort of ubiquitous and universal and experienced by all of us in one way, shape, or form. It's sort of the kind of the clinician shame, the fears around, am I good enough? Am I being helpful? The person in the next office is doing much better than me, or, so there's this sort of, but it actually is leveling, as you said, where we can sort of manage that sense of, we're separate from and not separate from each other's experiences, I guess, in a way. And it's an interesting, careful place to be as a therapist, I suppose, isn't it? Is to be able to, manage the self-care and the self-compassion for the therapist, I suppose, is sort of an interesting part of that. But yeah, that leveling sense, and I really appreciate what you said, that sometimes the shame and self-criticism begins in those really sometimes traumatic, but very difficult, complex social experiences. But that's also where the healing occurs, is in those safe and those safe social experiences that might come later.
That's absolutely right. And I think, one of the tricky things about shame is that it motivates us to do exactly the thing that feeds more shame. Right? Shame motivates us to disconnect, to hide, to conceal ourselves, to withdraw from people, from the world, right? And what we know is that that's also where shame breeds, right? Where shame multiplies. And so, in fact, helping people see that pattern and that cycle as one that makes a tremendous amount of sense. Of course, when we feel shame, it makes sense that we want to hide ourselves and pull away, right? And that also digs us deeper into disconnection and isolation. And so finding ways to come together. And I love what you just said about like our similarities and our differences. I think that's another thing I just really love about the model of CFT, is that we have both, and both are honored and both are acknowledged and worked with in these spaces.
So just before we finish, you mentioned the Compassion Collective, your podcast with your colleague Susan, was it? So yeah, what's the story there, and what do you sort of share on your Compassion Collective?
Yeah. So again, that was a passion project that started for me and Susan shortly after coming out of that. Again, I've mentioned it multiple times, that really transformative experience that we shared together in 2018. And it was during the pandemic, actually. Talk about period of a lot of isolation. Yeah. The very beginning of the pandemic in early 2020, that's when Susan and I started putting our heads together and started talking about wanting to start a podcast and wanting to create this space, this collective space, Compassion Collective, where people could come together and share resources, help share, ideas for each other, ways to engage more meaningfully with this work. And the podcast came about at that time as well as a way to, I think first it started as a way for us to interview, experts in the field of CFT, but also acceptance and commitment therapy and mindfulness. And then over time, as Susan and I also evolved, finished our doctoral training, evolved, into our early careers, beginning to have more conversations space for the two of us. So we then created more episodes where the two of us were going back and forth and having conversations about the interviews that we conducted, and sharing more about our experiences and our paths and the work that we do. And truth be told, because it is a passion project and the two of us are enormously busy with the other hats that we wear in our jobs, it's been a little bit since we've recorded our last episode. So it's actually something that we're talking about, kind of how to get into and where we go from here. But it's meant to be a community space.
Yes.
And so that's the value.
That was exactly what it's actually it's another, again, that community feel, that community space of bringing people together. And there's some great resources up there. I hadn't noticed when the last episode was, but there are lots of episodes up that people can still have a look at and listen to, I suppose. And I'll put the link to all of that in the description as well. Good luck if the two of you are sort of looking. It does take a lot of time, doesn't it?
It does. Yeah, you know. Yeah, it does.
Yeah, no, but it's good, and it is about community. Like I really appreciate you coming and speaking with me. It's been a delight to get to meet you, even in this online space. Hopefully, we'll touch base again. But Dr. Michaela Swee, thank you very much for coming on Compassion in a T-shirt.
Thank you, Stan.